بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. How are you? I hope that all of you are fine. This lecture is presented by Dr. Nura Sabah from Karbala Medical College, and we will discuss an important subject in gynecology, which is the fibroid and polyp, which are benign uterine lesions. What we will discuss, first of all, the definition of both of them, and what are the risk factors, how the types regarding fibroid, and how the patient will present it to us, what are the signs that may be found during examination, and how we will diagnose it by investigation. Then, what are the treatment options for these two lesions and the complications that may occur in the patients. First of all, we will discuss the endometrial polyps, which are focal endometrial outgrowths containing a variable amount of glands, stroma, and blood vessels, which influence their microscopic appearance. So, they are originated from the endometrium, and they can be seen in the endometrial cavity, or sometimes protruded from the cervix. The risk factors for the development of polyp are many. The important one is obesity, late menopause, the use of partial estrogen agonist, which is the tamoxifen, and sometimes even with HRT, and hypertension. In these lesions, what will happen is the increment in estrogen level, which affect the endometrium and increase the possibility of development of polyp. How the patient will present it who have endometrial polyp? The presentation will depend on the number, the size, and the position of the polyp. They can be pedunculated, large enough to be with pedicle. They may be single or multiple, covering all the endometrium. They may arise in the cervix. So, how the patient will be presented depends on the number and the as we say, the size of it. So sometimes the patient will be asymptomatic, and accidentally, by examination or when she do ultrasound for a reason or another, we will find endometrial polyp in these patients. Others will have symptoms. The commonest symptoms that may happen in those patients is abnormal uterine bleeding. And all forms of abnormal uterine bleeding can be present with patients with polyp. It can be heavy menstrual bleeding, intermenstrual bleeding, postcoital bleeding, or even postmenopausal bleeding. The other effect of polyp may affect the fertility of the woman. When it's large, that may affect the implantation, or sometimes multiple in number. So we should put that in mind when we want to manage those patients. Sometimes the first presentation of endometrial CA is by polyp. So each polyp should be sent for histopathological examination to exclude malignancy, especially if the women are more than 35 or 40 years. How can we diagnose polyp? There are many investigations that can help us in the diagnosis of endometrial polyp. First of all, the simplest one is transvaginal ultrasound, which help us, but sometimes especially if it is small, some sonorists may think that it is thick endometrium, not polyp. And it happened with me, with a patient. The sonarist the report of the ultrasound was thick endometrium, and the patient was presented with postmenopausal bleeding. And because of thick endometrium, we take biopsy from the endometrium. When I want to do the biopsy, to take the biopsy, I found that the endometrium is thin, not thick. Then I feel a lesion, and then I move it, and it was polyp, a large endometrial polyp. And when we send it for histopathology, it was benign, not malignant. So the two important investigations that will help us in the diagnosis of polyp is either hysteroscopy. When in hysteroscopy, we will directly examine the endometrial cavity, the cervical canal, so we can see the polyp, and also to discover many polyps which are small, and also the hysteroscope will help us to take biopsy, so it can be diagnostic and therapeutic at the same time. We do polypectomy and remove the polyp. And saline infusion sonography. These two investigations involve distending the uterine cavity with the fluid, thereby aiding the detection of polyp. This is the picture of uterine polyp. It has a small pedicle and it is a large one. This is another picture which is taken from hysteroscope. As you see, there's small blood vessels on the surface of the polyp. The treatment of the polyp will depend on the presentation of the patient and on the number and size of it. Some small polyps can spontaneously resolve, but the polyp that persists, it should be removed. We do polypectomy in order to alleviate the symptoms of abnormal uterine bleeding, to optimize fertility in subfertile women, and to exclude hyperplasia or cancer. Polypectomy is a simple procedure that can be performed as a day case under general anesthesia or as an outpatient with or without local anesthesia. A hysteroscope is used to visualize the polyp and to remove them. And thank you. This is the first part of the lecture, which was about endometrial polyp.